On this episode, we'll be welcoming Dr. Waj Hoda, chiropractor here at Totum. We're going to be talking about breathing and why it's so important, how it can reduce low back pain by improving spine stability, how it can improve sport and daily activity performance, and why you may not be doing it correctly. Waj, welcome back to the Totum Wellness Podcast. It's been a little bit of time since you were last here, and your friend Scott Fournier was on an episode earlier this season, and we got into DNS, or Dynamic Neuromuscular Stabilization. I know you're a huge fan of it. It's kind of where you met Scott. And we're going to be talking about breathing and breath and why that's so important, related to DNS, but also trunk stability,
everything.
Spine.
You got to breathe.
Protecting your spine, and performance, like us being able to move around and do things well. So why is breathing or breath so important?
Well, it's nice to be back. Breath we take it for granted. Like, we all breathe involuntarily. We have this diaphragm that works, which we'll talk about in a second, and it breathes for us. So you don't really have to think about it. And I think that's interesting because I think it's not thought about enough, because we also have voluntary control of the breath. And we're going to talk about how you can rehab breath, which sounds weird. How do you rehab breath? Using voluntary control. And that'll actually make a huge amount of difference in people's lives, just in terms of posture, how low back pain, just feeling generally less anxious. These are all like these kind of large concepts, and most people don't understand how breath is tied to all of those, but I'm looking forward to talking about it. So
it's really popular now.
Is it? Well, that's good.
There's a lot of classes that you can go to that would just work on breath work for half an hour, which to me kind of seems like a lot. Even as we're talking about it, then I think about breathing a little bit more, which I think is good. And like you said, we take it for granted. Mm-hmm. There are so many benefits. Tim and I did a little bit of research. We try to research a bit before the podcast. So what were some of the benefits that we found from
that
better
ChatGPT found?
Or, well, did you use Chat?
No, it was Copilot.
Copilot.
Yeah.
Much more sophisticated. What did you find?
I asked her top 5, and so stress reduction, improve focus, sleep benefits, so your sleep gets better when you breathe better, lower blood pressure, boost in energy.
Yeah.
Oh, that's all good.
Those were the 5.
And I think a lot of the professional athletes that we've worked with, I was talking with some of the strength and conditioning coaches of some baseball players, and they said they've been using this for years. Mm-hmm. And it is a competitive advantage to tap into this and understand how to use it.
Yep.
I think that we could have absolute universal agreement that we all probably, like you said, take it for granted. I also find some of the research really interesting where it says that we breathe so shallow that we just use like a very small portion of the top of our lungs, and we rarely get down into the lower level.
Yep.
Tell us about that.
Okay. Well, let me just briefly talk about nasal breathing versus mouth breathing. I'm going to start with that.
Super important.
Okay? Because I think that will tie into everything we want to talk about. So there's a huge proportion of our population that breathes through their mouth. And I think people listening to this for the first time or without a lot of knowledge on breath would be like, well, what's so wrong with that? Just from like a pure discomfort point of view, when you breathe through your mouth, you're drying out your mouth, and it's been tied to a lot of periodontal disease like cavities and gum, basically gum disease of any sort, because dry mouth isn't great, and then there's often a breath issue with that. So breathing through your mouth initially isn't great because you're just hurting your actual teeth and your mouth environment. But more than that, when you breathe through your nose, you're actually humidifying the air as you're breathing through your nose. It's also passing through your nasal cilia, these little nose hairs, and it's detoxifying your air. Filtering your air. So it's this natural filter. Yeah, definitely. But also, it forces you to breathe slower. Right? I mean, I think we can all picture that. It's just smaller holes. So you have to breathe slower. So from a sympathetic, parasympathetic system, which, very quickly, the sympathetic system is more, you can think of it as your like fight or flight system, and your parasympathetic is the restful system. If you're breathing slower, it tends to activate the parasympathetic system, which slows you down. And this is tied into anxiety, as we were talking about earlier. So there are a host of other things that nasal breathing helps with, blood pressure and of that. And without getting into too much detail, when you breathe through your nose, there's enzymes secreted that help produce nitric oxide. And the nitric oxide is a vasodilator, which means it actually helps open up blood vessels. That opening up helps with oxygen intake.
I didn't know that.
Yeah, me
right?
neither.
And so
It's fascinating.
there's a great book I'll recommend. James Nestor wrote a book called Breath.
Yeah, we've
And
read
all of this, most of the stuff I'm talking about nasal breathing and stuff, he's just great. The book is entertaining. I think he has a new edition coming out.
Oh,
actually,
great.
with some added stuff. But
The
that book is
tests were
fantastic.
crazy.
And it's not a technical read, right? I mean, there's some technical stuff, but it's by no means a technical read.
Yeah.
It's
No.
easy. He makes it very approachable.
Super approachable and really interesting
Their
because he did some of,
experiments were crazy where they take their mouth and then they did really hard workouts, forcing to breathe through their nose, and the results were crazy.
I tried that.
It
and
freaks
once.
me
I
out.
just tried it once.
It's pretty tough, right?
Yeah.
It's pretty.
Your mouth?
I just did a workout with my mouth closed
Okay.
for a while. Like I went for a run and I'm like, this is like really uncomfortable.
We find you passed out on the side of the street
basically.
somewhere.
It is really difficult.
Well, this is what I say with all biological concepts, that it's all dose-based. So like, this is the mistake with patients that I make is like, they hear a concept, like I'll say something, this is an example, right? Running would be good for you. And then I find out that their first run was like a 10K.
Right.
Right. We want to apply the right dosage. So I think that's the right idea, but we just want to start off by even understanding how it feels to breathe through your nose without any movement. Because what happens is I think people do it and they're like, I can't do this. It's way too hard.
Right.
And it becomes a problem. But what James was saying in his book, and what research has found, is if you constantly start breathing through your nose, the airway actually improve. You get more width and circumference of your nostrils and that airway up higher. The turbinates, they use this technical terms, but everything changes.
So valuable.
You get a huge amount of change in your sinuses and stuff. It changes the shape of your face. So there's, and he documents this they have MRI studies and ultrasounds and stuff. So it's really neat. So it just like exercise, you want to dose it and you want to slowly make it harder and harder. And then it becomes easier, just like exercise over time, and it becomes more natural. If children breathe through their mouth, which is actually quite common these days, and there are reasons for that, which I'll quickly go over in a second, and they get in a habit of breathing through their mouth, there's research out there that shows that it lengthens the jaw, it thins out the jaw. There's actual physical change in the shape of your jaw with mouth breathing. And there's a variety of reasons why. When you don't mouth breathe and your mouth is closed, the tongue sits on top of the roof of the mouth, and you can look this up. It's great. It's just amazing stuff, right? When the tongue is at the top of the roof of the mouth, it expands the arch, the top arch, and it actually starts to push your jaw wider. But also, if you breathe through your mouth, you end up shallow breathing. You tend to get less breath in. And like I said, it increases sympathetic drive, which can explain anxiety. Look, I'm not trying to say anxiety is but it can make anxiety worse, or it can make a kid feel more anxious. Just try to breathe quickly and shallowly, and you're going to feel anxious. Just the feeling.
Why is it more prevalent now with kids?
Well, again, I think it's multimodal there. But one of the big things is chewing hard substances creates strength through the muscles of mastication, and through their origin and insertion, it widens the jaw and it changes the shape of your face, and the width helps create less thinness in this area. Right. It actually opens up
the center of your face.
Yeah, we've had this conversation with our orthodontist because we're so interested in these types of things, obviously, and we have 3 kids, and you've got 2 kids, and watching them go through all this. We had 2 with braces. And it was exactly that the upper palate is shrinking.
100%.
And that's why braces are becoming more and more prevalent. And it's because we're not chewing food that is hard to chew, that we were designed to do. Another really interesting story about this, our daughter, when she was 5, she was having some behavioral issues and some sleeping issues. And then we started realizing at night she was snoring. We could hear her from the other room.
Yeah.
I took her to the pediatrician, and I basically said to the pediatrician, I want her tonsils out.
Yeah.
Because I said she's snoring all night. And thankfully, we had a great pediatrician that was up on this, because this is a long time ago. And she said, yeah, let's go for it. And and we had her tonsils removed, and she could then sleep with her mouth closed and breathe through her nose. And I'm not exaggerating. She became a different 5-year-old.
James
It was
documents
remarkable.
James documents this in his book. Like he really, look, there is research. I'm always careful to say that some of it is anecdotal, but some of it is higher quality research. But basically he goes through how this can really affect children behaviorally and also adults through anxiety. He thinks there's an ADHD connection. I hope I'm not misquoting him, but I'm pretty sure he thinks there's an ADHD connection.
It makes sense.
It's been a while since I've read his book, so I want to be careful. But if it's not him, it's a ton of other people that think, well, of course it makes sense. If you're not getting great ventilation, you're not getting great sleep. Sleep apnea is tied to this, right? And when people have sleep apnea, they're just not getting great ventilation. They wake up with headaches. They wake up with fatigue. They never get into super deep sleep. And through his book and through other research, we know that nasal breathing improves ventilation, oxygenation. You get deeper sleep. So that's why it's like so important to understand this. And so what I would say is the one caveat is you don't want to do this dramatically because it's going to be really difficult. And also, I don't want to vilify mouth breathing. At the very end of exercise where intensities are very high, you're going to want to pull from the mouth. And I think research has shown that at high ends of activity, mouth breathing and nose breathing, there's no major difference. But in moderate, like zone 2 to a little higher, trying to get nose breathing in is kind of from what the research shows, is almost like a cheat code for performance, right? You're getting better ventilation, you're getting better oxygenation. And
Agreed.
So this is tied into rib cage shape and diaphragms, which we can talk about as well. I hope I answered your question.
Absolutely. Let's talk a little bit about that idea of protecting the spine through breath. I'm fascinated by this because I think it probably relates to some back pain stuff.
Yeah, 100%, which is, what I see a lot of. And again, when patients come in and they have low back pain and I'm assessing their breath, it is, for them, they're like, what are we doing? And so, over time, I've kind of helped to bridge very quickly with patients why breathing is important. So this should be relatively easy for me to do. So essentially, your breath. So why can you breathe overnight without thinking about it? Well, there's this big muscle, a huge muscle called the diaphragm. People have heard about it, I think, but I'm not really sure they really understand it. So I'm going to do a quick little representation. The diaphragm sits sort of halfway in your thorax. So think of it as separating your, I don't know what you want to say, your upper body's contents from the upper floor and the lower floor. And the diaphragm is the dividing thing in between them. And this muscle is enormous. And what it does, it's controlled by a nerve called the phrenic nerve. The nerve, it's constantly creating an upward and downward movement of that diaphragm. So that's why you don't have to think about a breath. So when the diaphragm descends, so when this umbrella-shaped muscle descends downwards, it kind of squishes the abdominal contents down. Can you picture that?
Yep.
Your intestines,
it's like
your bladder.
Plunger kind of.
Like a plunger. It pushes the lower contents down, but it actually leaves more room in the top floor. And because there's more room, just through physics, air gets automatically sucked in. Right. There's room to fill. It's almost like a vacuum pulling air in. So that's what a breath through the diaphragm looks like. All it is this muscle pulls down and it sucks air involuntarily in, and that's breathing. But in squishing these contents of your abdomen down, if you can think of a basketball that's, inflated, if you push that basketball, from the top and you push it down towards the floor, you can see how it would kind of almost bulge out the sides a little bit. It creates more pressure down low. And that more pressure creates more stiffness. So a good analogy would, again, be maybe a partially filled volleyball. If I squish it down, it now becomes packed and hard to move.
With the sides
squished out, it just becomes less mobile. A partially inflated volleyball, you can move it around, you can squish it inside, outside, you can push into it, and you can actually get some, deformation. Yeah. But when you have this volleyball squished down under pressure, you can't move it. You can't distend it, you can't deform it. Does that make sense? So if you think about that, that's actually happening in the lower half of you, which makes it very hard to move the spine. This confers automatic stability. So your muscles don't have to work hard gripping and co-contracting, trying to keep your spine stable. You have this just through the breath. Just through the breath. Yes, there's diaphragmatic activity, but just through the breath, you're getting this stiffening that actually prevents lumbar spine movement. And when we talk about deadlifts and athletic activity, people hurt themselves because this is exactly what happens. There's not enough lumbar stability, and you get movement through the spine. They've shown this on they've happened to catch people deadlifting, and right at an injurious state, you'll actually see the vertebrae slightly slip. This arguably can all be helped by this stiffening. We call it intra-abdominal pressure, and it's governed by the breath through the diaphragm and your abs. So I use that example of the volleyball. If the volleyball's walls were really not stiff and they were really loose, well, you'd squish, and then the walls would just continue to distend outwards.
Like if it was an old volleyball.
Like if it was an old volleyball, right?
Thin wall.
Your abs are the walls of that volleyball. And if they're robust and strong, they do distend a little bit, but then they stop it.
They
stop it. They contract it. So I've just explained a model of what intra-abdominal pressure is. Right. The diaphragm descends, increases pressure. The abdominal walls and the pelvic floor stop it from going too far. And then you have this really rigid-ish structure stabilizing your spine.
I love that.
And then if your breathing is compromised, so you're not breathing as deeply as you should be naturally.
Yep.
It's like you're not pushing that volleyball as hard.
You're not using your diaphragm.
Well, just in normal breath, without any effort, it should descend 1 to 2 centimeters. The diaphragm's descending. But when you really, really want to get a good breath in and have stability, it should descend up to 10 to 12 centimeters.
Oof.
Wow.
That is a lot.
It's a big difference.
Right, there's a huge, that's what I'm saying, that dividing floor is dropping quite a bit to produce this. So yeah, if your breathing is compromised and you can't get a deep breath, which just goes back to what I was saying about nasal breathing versus mouth breathing, if you can't get a deep breath, you can't get great diaphragmatic excursion downwards. And so you're not able to get this automatic conferred stability that you're getting essentially for free.
And it's interesting that it's that different from 2 centimeters to 10 to 12. That's a huge difference, and it would be a huge difference in pressure.
A massive difference
because we're not
in pressure.
dealing with a lot of size there.
Yeah,
I had a patient come in yesterday with acute low back pain from a strain, and we'll see what you think about what I talked to her about, because it happened on the weekend and I'm not available and they're in a panic, and she was putting a heating pad on her back and ended up with actual burns from the heating pad.
Yeah, been there myself, yeah.
And we tried to talk about what could you do. And I said, getting into a comfortable position, and she and I had worked on square breathing before. And I said, even just to do that, to let the muscles know that they're working and that there's oxygen coming to them, I said, should help you feel a little bit better and, alleviate some of that pain.
Definitely.
Do you agree?
Oh yeah, on so many levels. So if you, someone who's in acute pain, I mean, listen, let's just picture you spraining your ankle or hurting yourself. If you pay attention, you're breathing very fast at that moment. You're just you'll just realize your respiratory rate goes up.
Sympathetic is up.
Yeah, your sympathetic drive goes up. And, part of when your sympathetic drive is up, without going into too much detail, because we could talk about this forever, your sensitivity to pain, arguably, after a while, not initially, but after a while, your sensitivity to pain goes up. Has to do with fight or flight. So initially, if you hurt yourself, you may not even notice it. That's the adrenaline effect.
The adrenaline.
But eventually, over time, if the stress continues, you may be more aware and more hypervigilant and more, you just feel more pain. And this is mediated by brain pathways and stuff. But if you slow your breath down, and you do meaningful box breathing, or what happens is you stimulate your parasympathetic system, which is your the opposite of the fight or flight.
Rest,
and what people
repair.
do, yeah, when I prescribe this, it's just hilarious. I'll give it to patients, and if they do it right, they'll immediately start yawning. They do it, and all of a sudden they'll start yawning. It'll promote this relaxation. Now the relaxation reduces muscle tone, so that if there's a spasm or there's a lot of guarding, it can rest that. It can help relax that, but there's more ventilation, more oxygenation. So arguably better for, just healing. The environment improves. And in some way, if you're doing really gentle box breathing, you're getting some stimulation of some of these trunk muscles. But more than that, and I think this is often missed, is that movement, as you know, is medicine. And when the diaphragm descends and ascends and the rib cage is shifting and moving, outward and inward, you're getting movement, which promotes fluid dynamics and all of these other things that are tied in with healing. So breath alone can help with these acute phases, subacute phases, and certainly people with chronic pain have this altered breathing pattern where it's like very shallow, really mouthy. And people who in chronic pain can really benefit. Breathing, anybody who comes in with chronic pain in my practice, breathing is like almost, it's so obvious with most chronic pain patients that their breathing is dysregulated, and just helping them with such an easy concept. And that's the thing I like about it. It doesn't cost any money. They don't have to buy any product. There are some things that can help them, but it's such an easy concept. And it has so many real world impacts that are helpful. And it's just a free concept, right? It's just so easy to apply.
Does doing, like if I roll my ankle today and I start doing that controlled breathing, nasal breathing afterwards, am I going to have a shorter recovery time than if I just let it go into sympathetic?
I think that's really going to be hard to measure, but let's just say theoretically the answer is yes.
Right.
But, have there been studies on this? No. But this is the most important part of it. It's free. And it takes almost no time to do it a few times a day.
It's good for everything else.
And it's good for everything else. So there's really no downside.
Yeah.
So the relative risk is almost zero to do anything harmful, and just so many upsides. So even though I can't definitively tell you that you will recover because we just don't have studies, I'm sure you will. And, I think chiros and physios and manual therapists will tell you patients who have low sympathetic drive, which means they're not tense and they're pretty relaxed, tend to have increased performance and heal much quicker than patients who have this anxious, hypersympathetic drive. I want to make sure I'm not vilifying the sympathetic system. It's why athletes can do what they do.
Sure.
But you need to be able to relax, which is the parasympathetic system, especially when you're not doing the activity that you want to do.
For recovery.
If you're not stressed and you can't slow your breathing down naturally, you can't rest, you're just not going to recover very quickly.
I want to talk about this on a real practical level so that our listeners can say, okay, what do I do after I listen to the podcast? What should I do? So let's walk through. You have a patient coming in with, let's say, chronic low back pain. You recognize that they are mostly breathing through their mouth. They're not engaging their diaphragm. What are your next steps, and then how do you teach them to become a better breather?
So, you'd mentioned Scott Fournier. Both him and I really love the DNS concepts. So, initially when someone comes in with anything, I use some DNS testing. Patients obviously don't need to do this, but there are ways to assess your own breathing quality. And so there's a test for the diaphragm and the diaphragm activity. And so I basically place my hands around their rib cage and first of all, assess whether breathing is really a big part of it. And usually with chronic low back pain, it is. But you essentially kind of like put your hands around your rib cage, your lower rib cage, right?
Lower rib cage.
And then you don't take a big breath, because if you take a big breath, it's going to change everything. But you take a normal size breath. And what you're trying to understand is whether or not you can feel excursion or movement of your rib cage outward.
Out.
And if you can, with your thumbs in the back,
yes,
also feeling a little bit of posterior expansion. So like I said, if the diaphragm is active and I'm pushing the volleyball down, you should feel like a squishing effect in all areas. You should feel like the whole rib cage shift laterally, posteriorly, and some anteriorly. Without going into a lot of detail again, people tend to overdo the anterior expansion and underdo the side and back expansion. And there's a whole reason why, but maybe we can save that for another day.
We call that rib flare.
Yeah, exactly.
A little bit. We're looking for that.
Definitely.
All right. So
I would assess that first.
You're checking. Yeah, you're checking that, which I'm checking right now. And so you see some problems with it. So let's say that you see that anterior rib flare, like the top of the rib cage is popping forward.
Yeah.
What do you do next? How do you cue them to maybe get a little better at their breathing?
Yeah, it's interesting. It's like any task. Some people are very, very quick at getting, like a cue or advice. So I work with the patient's sort of like ability, but essentially, I try to help explain to them, as we talked earlier, how important the breath is, because it can be confusing when they come in with low back pain. you know, and I'm working on their breath.
Have you ever had anyone just walk out?
Not yet. But,
Okay, good. You're
you know,
good at communicating this.
I've stopped them on the way out. No, I'm just, but not yet. But so you know, I communicate with them, but I actually often get them to put their hands there, and then they can feel it. And then what I'll do is, if they need more cueing, I'll show them mine, and it's pretty obvious what real excursion and movement feels like versus not. And they're often just flabbergasted that they can't expand.
Very easy to feel it,
right? Yeah. That they can't expand their rib cage, and so what they end up often doing, and I try to show them in a mirror, is that instead of expanding outward, they kind of do this like upward translation of the
shoulders
rib cage,
up,
right?
right.
If you have to have air coming in, what ends up happening is they try to like almost mouth breathe or breathe using muscles of their neck to lift their rib cage up. It's like an attempt to get more air in. So they can often come in with neck pain as well as low back pain for this reason.
From that tension.
Yeah. And so I essentially, you know, I teach them how to, I cue them in all these different ways. And I would suggest to patients or people who have pain to consult someone, because the problem is if you kind of don't, there's a lot of, you know, different advice on the web. And depending on its, you know, legitimacy, you might be getting wrong advice. Like belly breathing, for instance, is controversial. And so I'm describing this expansion. So you are going to get some expansion in the belly. But I keep seeing patients over and over again who think that belly breathing means pushing your belly out. And that is that is really not a great cue. That is not
the volleyball we're going for.
No, right? We're not trying to distend the belly out.
One part of it.
Yeah, exactly.
Yeah.
So making sure they're getting the right cues that is proper for that patient. You can prescribe something to a population, but everybody's going to have a different dosage or a different medicine required for the same thing. I always try to use these analogies. Depending on who you are, you might need a different cue, or you might need some help. So I'll cue them into breathing. And honestly, I've never had anyone not sort of at least get an idea of it, even on that first go. It's just without making it sound like the practitioner is very important. It's important to help them get there, cue them with the right instructions, help them feel it, have them leave with some confidence. But it really is that easy. And then once they get it, it's kind of like riding a bike. Once you're like, oh, this is not that hard. And then within days, it becomes super easy. And the goal is if you practice this somewhat regularly, like, 2 or 3 times a day for 10 or 15 breaths, it starts to become subconscious, right? The idea is that if you practice this enough, your system, because it's an inborn mechanism that we all are born with, this automatic diaphragmatic breathing, which we notice in babies, it'll eventually come back online. And I see that all the time.
It's just a reset.
That's so interesting.
I'm very visual when I think about these things. So if I've got a balloon inside my abdominals, thinking about how that expands in all areas, like 360-degree expansion, like that's kind of, I think, what you're talking about. Is that right?
Yeah, absolutely. But the expansion is happening because the diaphragm is pushing the contents down.
Right.
You aren't trying to, bear down like if you were in the bathroom for it. Like all of these concepts, by the way, of bearing down.
It's not a Valsalva.
It's not about it. That isn't what we're trying to do. And also, some people not only bear down, they literally try to push.
Right.
They try to push their belly forward. You literally will see people coming in. Maybe a yoga instructor has taught them this. And look, I love yoga. I'm not trying to vilify it, but it just depends on the instructor. Maybe an instructor has taught them that what they really want to do is push their belly out. And pushing your belly out is just not how you activate the diaphragm. I can push my belly out with no diaphragmatic activity. Right. It should be a secondary effect of using the diaphragm. That's why the cues become important, because if someone just thinks and they hear us and they think, oh, I should just like expand everything, and they're literally trying to push out, that is not the effect.
I like the idea of regular practice. I have another analogy because I like to make the podcast about me. It's true. We did this testing a while back it was advanced physical testing. I think we had talked to you about it, something new that we're working on that's very exciting. What wasn't exciting was that I am not in as good shape as I used to be a long time ago.
Welcome to the club.
Right? And when I got my test results, I had a minor panic attack and went, oh my God, this is way worse than I thought it was, because we work in this world and we live in this world and you feel okay and you're doing all the right things from sleep and nutrition and all that. So you think you're okay until you get like an MVO2 score or a DEXA score and you realize, oh my God, things have really gone off the rails.
Yeah, sure.
As a result of this, I started back into, I needed to get my cardiovascular system back in better shape. So I started doing mile repeats on the treadmill.
Sure.
So basically I'm running a mile as fast as I can. At the same time, I got this ultrahuman ring. So now my heart rate is being tracked constantly on the treadmill.
Yes.
And what's really interesting about it is that when I'm doing this, because I'm in bad shape, my heart rate is going to 190.
Oh, wow.
Right? I've always had a higher heart rate.
You know what? 220 minus your age. You're only 30 years old. So that works out really well.
It's so bad, actually.
I thought
now that I say that. But what I noticed was the thing I'm struggling with the most is breathing.
Yeah.
And it's funny because you're just on a treadmill, so you really notice it. And I've read the book and I'm trying to breathe through my nose as much as I can. And then because I'm thinking about it and because I'm seeing my heart rate at 190, I think it's making me freak out a bit and it's making it go worse. And then I realize, then I start breathing through my mouth, obviously, because I need that much oxygen.
Sure.
But I also, it's just not working yet. I know it will.
Yeah.
But I'm kind of blown away at how much I've lost and that as a young person, it was there and I didn't have to think about it.
Yeah, I'll say a few things here because I love this. Look, what people don't understand also about the diaphragm is when it when it actually descends on an in-breath, as I said, it kind of helps you suck air in. So, if you have these two balloons in your chest cavity that are getting bigger, your whole rib cage needs to expand, right? If you picture two balloons expanding really deeply, you're getting this massive movement around your rib cage. So people who kind of lose sort of functional breathing, non-dysfunctional breathing, they actually don't move their rib cage a lot. Okay, so you'll see this over and over again as we get older. If you watch a young infant, we've had kids sleep. You're just going to see this massive excursion,
right?
Breath in, breath out, and it's kind of like someone who's in my world. It's beautiful. Like you're just looking at the human form, and you're just seeing it work so well, and it's so intuitive. You're like, that looks so great. Well, as we get older, things get stiffer and it just doesn't expand as much. And then, of course, if you're not doing, end range physical activity, you're also not getting all the air in the lungs that you would if you were really fit, constantly getting maximal tidal volume and all of these, getting all the air you can in. And if you sit all day and you're not doing any movement, the thoracic cage is also becoming very tight. And basically what I'm saying is that you get really stiff. So you aren't able to just expand. Number one. Number two, you're not getting this massive diaphragm to exercise. And they've done studies on this. You lose, just like any muscle, you lose its ability to function, and you actually can see changes morphologically in the diaphragm and structurally. So you're getting a weaker, thinner diaphragm. And so right now, just like any exercise, you're strengthening your diaphragm. Yeah. And in a few months, if you keep doing this properly, your diaphragm gets more active, works better, helps control your rib cage. You get more rib cage movement. But of course, someone like me can help expedite the process with giving you good cueing. And I would recommend on very maximal efforts, don't focus too much on nose breathing, especially at this stage. Yeah. But you're going to see incredible athletes at the top end who can just nose breathe at the very end of their limit. It's pretty fantastic.
So on this point, because I'm a bit ahead of Stacy on the cardiovascular recovery. Seriously.
Yes.
True.
I've started to do whatever. I'm running 3 times a week. And just in this last month, the next day after I do one of these, like maybe something that's more challenging, either lower intensity longer or high intensity short.
Yeah.
Like last night was very hard cardiovascular workout. And today my whole chest cavity just feels alive.
Yeah.
It really does. It's such an interesting experience because, I had to get deconditioned to understand what that actually feels like. Yeah, and it's taken me, I'd say 6 months of sort of this, not super, I'm 3 times a week and I'm not putting hours and hours into it.
Yeah.
But it's like I'm now like month 5, month 6, like, oh, I can really start to feel this now. So,
I think we'd say this to our patients and clients who are working out. We are working you out. You're going to see changes, but you'll really see changes down the road. Some of these changes take months to see real physical changes. And also people feel better quickly because the nerves start firing. Within a couple of weeks, they're starting to fire better. But you will see some great changes after a month or two when the actual muscle has to start getting stronger as well. So you get this neurological change initially, the better firing of the diaphragm or any muscle that you're working. And then eventually you actually get muscular changes, whether it's, increase in, hypertrophy, for instance. And so after a few months, that's when you really start noticing change. And so that's it. We have to just be patient with the breathing. And that's the big one. I think a lot of people they hear a podcast or they read a book, they try it out, and it can be really frustrating because they're overdosing. They're literally trying too much too soon. And then they're just saying, well, this doesn't work. It just feels so unnatural. I hear it all the time. I can't breathe through my nose. It's too hard. And I'm like, well, try to not exercise first and breathe through your nose. Try to just breathe through your nose during the day with not extra effort, because that's hard enough for you.
Right.
Then start to do it on walks, then start to do it on jogs, then start to do it lifting, and then just build up slowly this way. Because honestly, most people just quit early and they're just missing out on all
I think this is awesome information. I think that this is a number one resource for people to use for breathing and breath work. I think that the James Nestor's book is an awesome starting point as well, because as we talked about, it starts as a fairly it's a casual read, but really interesting.
Yeah.
And then you try some of this stuff. And the last thing I'll say on this is when I was reading, talking about the full expansion, I thought about it in thirds. So top third, middle third, bottom third, which is the lowest part of your lungs under your rib cage. I'm like, I want to fill that stuff up, like absolutely full. And so as I'm breathing in, it passes the top third, middle third, and then I'm like filling up, and it's the very you're just, that's at the end. We're trying not to strain too much, obviously, but I found that as an exercise, awesome, especially at bedtime, because it just knocks you out. Like it makes you relaxed.
Yeah, well, 100%. Well, okay, so theoretically, I'm going to say something interesting to what you said. Like fluid, which air and gases are called fluid. Fluids settle. So when you first take your breath, weirdly, it goes down it starts off at the bottom of your lung. It fills. Most people have a ton of problems getting their rib cage expanded up top, right? So what I'm saying is when most people try that have dysfunctional breathing, they're going up and down. So there's no circumferential expansion at all. What I'm trying to get most of my patients doing, Stacy had brought up anterior rib flare. Some people just can fill down low and they just never get filling anywhere else. And so what we try to do is try to almost visualize at the end of the breath, trying to get expansion circumferentially, not up and down, but circumferentially in the back where their shoulder blades are and in the front of the sternum on a deeper breath. You're not going to notice this as much on a very shallow breath, but on a deeper breath, you want to be able to feel your rib cage expand. And when I give this to patients and they do it well, they feel so much tightness. They actually feel almost discomfort around their rib cage. I think there's a ton of issues like costochondritis, things that we don't realize are tied to breath that I think are very much tied to breath. Because what happens if you can't get breath in here, the sternum, the rib cage in the front, it just doesn't move a lot. So it gets very stiff and then you lose its function. Anyways.
Well, and if it hasn't been tested, right? Yeah. And I think that's why we're seeing a lot of this in children because of probably devices. You don't want to always blame that. But if you're not...
We always want to blame it.
We do.
Anything about
I don't mind blaming devices.
If you're not pushing... So normally you would expect a kid to grow up and to spend a big portion of every day sprinting full out and playing games and outside, like breathing at their maximal heart rate, which means that every day they would get that expansion and that would continue into their 20s, and it doesn't anymore. It stops probably at about 13 or 14 because they stop doing phys ed, they stop playing outside.
Couldn't agree
and
more.
They're not sprinting around.
Yeah, this is analogous to literally your muscles that we see visibly, right? These kids aren't, they're growing up and we're seeing them not kind of, maybe we're just have a lens that's unique, but our era, a lot of kids seemed healthy and fit for a long time. And I feel like, when I see the cohort of kids my son's with, for instance, you do have a group that's sort of healthy, and this always existed, but there does seem to be a larger group of kids who have poor posture, which again is related to breathing, but also just don't have great muscle tone. Well, if their muscle tone isn't great, it often means they're not probably doing a lot of activity. So what does their diaphragm look like?
Exactly.
Do you see what I mean?
I do.
And it just kind of drives this whole thing forward. So I agree with you.
Okay, so we have to pivot now, and all the kids, we're going to have to put breath work into the schools.
Yeah. I mean, it's so fundamental, right? We take it for granted.
Pardon?
Doug Ford already has a program for that.
No comment.
No comment on that. Okay, my final question for you. What exercises, if we were going to do this, what exercises do you find are the most effective? Like, what would be like your top 2 things you'd send someone to say, okay, go do this? You said work on the breathing 3 times a day, but a little more specific, like what exercises do you love for this?
Okay. So it depends on the patient and what they need, right? So that there's, again, this idea that there's a prescription that is going to work for everybody. Depending on what the patient's issue is, let's just start with like a very generic patient.
Yeah,
they're not able to get rib circumferential expansion. So what I would do is I would teach them to put their hands around the lowest border of their ribs, which, by the way, the lowest border of your ribs are very mobile. Patients are always surprised by this, but you can squish them. You'll notice you can move them. And then you're going to tell them to add some pressure downwards. They don't want to squeeze, but some pressure inwards. And then have their thumbs closer to the back, around, where your kidneys would be. And then what you want to do is ask them to not take a large breath, because that'll change everything. Just tell them to take a regular size breath. And they want to feel expansion of their rib cage into your hands. Like you want to feel the front pushing your front fingers forward. Where your palm is should be going outward.
Yeah.
And where your thumb is should be going backwards.
Yeah.
And again, this is more of a mental task at first than a physical, because if they try really hard physically, they're just going to default to the old set of breathing where they just go up and down and they get very frustrated. So you just say, don't try. It's a paradoxical thing. Just imagine the ribs moving outward. And then eventually they do get that. And I tell them to do it for like 5 to 10 breaths, once in the morning, once in the afternoon, once in the evening. Convincing very high functioning people or like very elite athletes to do this is very hard, because it feels like they're doing nothing. But if you explain it well, then they're bought in. Because what is more important than oxygen and breathing? If you're ATP and oxygen. Those are important things, right? Energy and oxygen. So they get it quickly.
Okay, I love that.
Waj, awesome education for us all. I mean, Stacy and I always get a lot of information out of these sessions with you. So thank you very much. And I know our listeners do as well.
It's my pleasure. I love it.
Okay, next week.
Done.
Let's go.
Let's go.
Thanks for listening to the Totum Wellness Podcast. Please follow us on Apple, Google, or Spotify and leave a 5-star review and comment. Subscribe to us on our YouTube channel, and please spread the word to family and friends.